So it's a great honor for me to be invited to speak at this international conference, IFOTES, and I'm going to talk about the psychological consequences of the pandemic and wars on mental health. As we already experienced, the coronavirus outbreak first began in December 2019, almost 3 years ago in China, and it evolved to a global health crisis and has made its severe somatic and mental health impact on individuals, on societies, patients, as well as on healthcare workers. The prevalence of the COVID-19 worldwide huge. Number of people infected, around 350 million people, and deaths around 6.5 million persons. In Hungary also made its impact by infecting about 2.1 million persons. I just checked it today, the government info about pandemic and coronavirus. And the number of deaths, approximately 48,000 people. So the number of infected people is equal to the population of our capital, Budapest, and the number of deaths is equal to the population of a smaller but very nice, smaller but not small historical town, Eger, whom now in this international situation, I must mention that Eger was a hero defending Hungary and the Habsburg Empire against the Turkish and Ottoman Empire. I just would like to give a little bit background information in pandemics throughout human history. So human history has been plagued by epidemics, and unfortunately and suddenly, even in the age of modern medicine, a devastating pandemic can still occur at any time. The 6 most deadly infectious diseases up to now was the plague, smallpox, cholera, influenza, AIDS, and Ebola virus. And the mankind in the Middle Ages and the early modern times prayed for help against 3 threats: save us from the plague, save us from starvation, and from the war, O Lord. We must admit that we are still in the same situation, and even maybe 500 or 600 years later, we have the same 3 threats we can see. During the 18th century, Europe finally got rid of the first of the 3 scourges, but the dread Black Death of centuries was replaced in the first half of the 19th century by the equally fearsome cholera. So it devastated Hungary as well and claimed at least 1 million victims. Now it doesn't want to step over. Oh my God. In Europe, the plague epidemic occurred after 540, in which the Byzantine Emperor Justinian was infected but survived, and the death toll of this epidemic was at least 25 million people. And at the height of the epidemic, up to 5,000 people died every day in Constantinople, the capital of the empire. Today is Istanbul. By the end of the epidemic, 40% of the city's population had died of the disease, so many and so quickly that the bodies lay in heaps because they couldn't be buried or burned. During the 14th century, the disease spread over the continent, and the Black Death claimed lives at least 75 million people and 200 million at most. You can see here the plague doctor who wore an easily washable cloak, hat and gloves, his face covered with a long beak-like mask containing perfumes, herbs, strong spices, and his eyes were protected by crystal glass spectacles. He held a wand in his hand so as not to touch the patients, even accidentally. It was so to protect him from the Black Death. So we can recognize that at the beginning of the COVID-19, actually, we didn't have more tools than people had in the Middle Ages. You see, keeping distance, quarantine, and using vitamins and herbs. Here is a picture of the plague epidemic in Marseille. And during the plague in Hungary, the citizens vowed to erect a statue to the Holy Trinity in gratitude once the plague had passed. But this kind of statues of Holy Trinity can be seen throughout Europe on the plazas of the main cities. I think we know it. And then the great cholera epidemic came. In the Habsburg Empire, together with Transylvania, about 250,000 people died in 1831. Once again, it was a huge concern. And you can see from this picture how dreadsome and fearful was the cholera for the people. The health authorities were helpless in the face of this unknown disease, and they tried to stop the spread of the cholera by road closures and quarantines, just we have done it 3 years ago, with no success. So there were mass graves, bells were ringing all the day, and there were unceremonious burial of the deceased. So this whole picture was a kind of apocalyptic for everyone. And the other actuality, unfortunately, is the war. So we can see that epidemic and pandemia can occur not only today, but throughout history. And this is the same situation, even if now actual, but this is the same with the wars. Just keep in mind that from the beginning of human history, wars and conflicts were there, and people just fought against each other. And since now it's November, I would like to mention 1956 October Budapest. So it was again kind of war, of course. And now the Ukraine people, the Ukraine war. Unfortunately, I make an animated version of this diaporama, but since you can see it only in small pictures now, I cannot show the same way as I just wanted. So this is today the Ukraine. It is our neighboring country, and it is just unbelievable. So we can say that everyday life has changed fundamentally since March 2020. There was uncertainty, unpredictability, fear of infection, quarantine, restrictions, mask, keeping distance, concern for our loved ones. People were separated and isolated from each other, and families, even close relatives, were isolated from each other. The daily routine was disrupted. And of course, financial difficulties occurred. 20% of the population developed depression. So the epidemic is not only a threat to physical health, but also to mental health. If we think about the effects of the pandemic, it is a threat to health condition, health anxiety, lockdown and quarantine, isolation and loneliness, interdependency, overload, taking responsibility for each other, constructive attitude, cooperation occurred many times, luckily, and the destructive way and destructive attitude is blaming and hostility. And if we compare this situation and people's behavior with the war, it's very interesting to see that the effect is almost the same. Threat to health condition, confinement, isolation and loneliness, interdependency, chaos, isolation, separation of families from each other, family members from each other, taking responsibility for each other, and also people cope with the war with constructive attitude or destructive attitude, depending on their situation, personality, and social environment. So we can say that it's a crisis situation, and Kaplan's definition from as early as 1964 that the crisis situation is a situation in which the person is forced to face circumstances that threaten his or her psychological equilibrium, and that he or she can neither avoid nor solve the situation or the problem with his or her normal, common, usual problem-solving tools. So it's very difficult for everyone, but even more difficult, it was more difficult for healthcare workers. So let me give you a little overview how it affected healthcare workers, because everyone was exposed, of course, the pandemic, but extreme effect was put on and stress was put on healthcare workers. And then we can turn our attention toward the coping and how can we cope with these extreme and very difficult traumatizing situations. So healthcare workers were also affected by the same stressors as the general population, but with the fear of infection, quarantine, what I just mentioned previously. But the stressors were compounded by an unfamiliar work environment, a different area of expertise from their own when, for example, a dermatologist or psychiatrist or a gastroenterologist were sent to emergency care unit and intensive care unit. So it was a different area of expertise from their own. A lot of patient care, a lot of deaths, often watched helplessly, and end-of-life decisions. In fact, in my everyday work, I lead a psychotherapy, outpatient psychotherapy unit at Semmelweis University. We have seen a lot of healthcare workers with panic disorder because they have seen so many deaths that it was just traumatizing. Then the stressors, also compounded by the period of illness and recovery caused by the epidemic, is also uncontrollable, often even for professionals. So it was a constant fear, uncertainty, and unpredictability, which led chronic stress, exhaustion, somatic and psychological consequences. Let me show you some research about this field. So post-traumatic stress disorder was developed, unfortunately, among healthcare workers. 61% reported symptoms of depression. Remember that in the general population, 20% of the people develop depression. Healthcare workers, 61%. Then 52% developed sleep disorders, according to a 2020 study. 44% suffers from anxiety disorder, and 75% experience symptoms of post-traumatic stress disorder. So it's very important to raise awareness of the challenges and severe psychological consequences that these colleagues or national heroes, we can say, are facing after working in COVID-19 healthcare units. And of course, we have to keep in mind the secondary traumatization, which is called in another word compassion fatigue, because PTSD is the most common psychological disorder following traumatization. So we can think that the 75% of PTSD among healthcare workers can be attributed to secondary traumatization. And the three most characteristic symptoms are intrusive flashbacks of very, very difficult pictures, withdrawal, and hypervigilance. This is why they actually face with panic nowadays. And the traumatic experience causes a loss of the individual's sense of safety, both physical and emotional. But what can we see? We can see that luckily, not everyone develops depression, anxiety disorder, and post-traumatic stress disorder. The numbers doesn't show that 100% of the workers or 100% of the population develops and faces depression, anxiety disorder, and mental health problems. In other words, there are people who are able to cope with this even difficult situation. And let's see a little bit about it, the coping and the coping possibilities. So coping depends on the environmental factors, of course, about the genetic and biological processes and the mental cognitive evaluation of the situation. This is what cognitive theory and cognitive theory tells us, and cognitive research tells us about coping. And I would like to show a very, very new study made by and conducted by my colleagues at Semmelweis University about PTSD, about the relationship of PTSD and coping style. We can see that emotion-focused coping strategy is more common in the group with high PTSD total score, and problem-focused coping and perceived social support may have a protective effect on PTSD. So they conducted a study with more than 400 people, and the results show that problem-focused preference was strongly correlated with social. That problem-focused preference was correlated with social support and resilience. Resilience was also related to social support, and the peer support and adaptive coping. We know that these are very important protective factors. And the graphs show us, you can see here the correlation between problem-focused preference and social support. In other words, social support is a protective factor, and problem-focused preference is a protective factor against PTSD, and so as resilience. So these results give us hope that it's possible to cope with even difficult situations, but it's good to be aware of how can we do that and what psychological research shows us about this. Actually, this is the basic statement of positive psychology. It's not the stress that kills us, it's the effective adaptation to stress that allows us to live. So this gives us hope, and the question is how. So now I would like to give a kind of overview about research, what research show us about coping. First thing which is important in order to maintain our mental health is normalization.
Dora, you have 10 minutes left. Is that okay?
Yes. I have a clock also, a watch here, okay. So I follow the time. Thank you very much. So first thing is normalization. It's very important to have an insight that in this situation, such as a war, a crisis, a pandemic, worry and anxiety are absolutely normal part of everyone. It's a common human experience, and it's very unusual situation with lots of uncertainties. So it's not unusual, or it's not pathological to be afraid of, to be depressed or anxious. So first thing is to normalize this, that it's normal to feel imbalanced, anxious, and depressed. Lots of people ruminate a lot about their worries. So clinical psychology tells us that we can practice postponing worries. Instead of rumination, we can be aware of our rumination, and we can use it in a constructive way. Of course, we need to face our worries, but not 24 hours a day. So it's a very good technique in cognitive behavior therapy that each day set aside a specific time to intentionally address your worries, it's called constructive worry time. And during other hours of the day, please do not address worries until you reach your designated worry time. So maximum 30 minutes is healthy, I would say, to concentrate and ruminate the problems, but then it's better to set aside the problems we cannot change. It's also very important to be aware and to differentiate between real and perceived danger. During this crisis situation, of course, there are real problems, and we can try to solve, it's possible, but there are uncontrollable problems which we cannot solve. So this way, what the new psychological approaches show us, accept it and use mindfulness. And of course, there are things, there are situations, there are people, health anxious people and other people who tend to catastrophize the situation in panic, in social anxiety, in health anxiety. These are so-called perceived problems when they catastrophize. So it's a good thing to differentiate between real and perceived danger and ask a question from us that it's real or maybe we catastrophize. If it's possible to solve the situation, as I just mentioned, because it's a controllable problem, then we can use problem solving also. And it's well known, and here you can see the well-known steps of problem solving, but yes, of course, I don't have time to talk about it in detail. Then it's still possible to create a new balance and psychological well-being, even if it's difficult. The question is how. We can try to give a sense of development to ourselves and finding new tasks for us. Then, of course, we know from interpersonal psychotherapy research that these are the relationships which keep us, I would say, happy and maintain our well-being. So to have contact and giving intimacy is extremely important to psychological well-being. And of course, trying to have joyful activities or activities which are pleasant for us. Maybe it's unusual that I talk about it during a wartime or in a crisis situation, but keeping in mind that, for example, during the pandemic, people were in very, very different situation. At the emergency unit, of course, it was not possible, but people who were in home office, for example, they could, instead of being frustrated, they can use constructively their time. And this is a good possibility to create a new balance to psychological well-being. Then it's very important to have a responsible news consumption. Not all the day just listening to the radio or TV or internet about the news, but just with the rumination to set a time during the day to facing the worries. The same with the news consumption, just set a time, maybe an hour or half an hour. And this is the responsible news consumption, not that all the day listening to the news. Then volunteering is extremely helpful to the maintenance of psychological well-being, because when people feel helpless or feel out of control and they volunteer and help others, they can gain some control also. So it's a good thing to do good things to other people. It's a good thing to help other people. And this is the way how volunteering maintains and contributes to mental health. We can practice self-compassion, which is to give ourselves the same kindness and care we would like to give to a good friend. And if we make mistakes, of course, or if we have conflicts or difficult situation, just try to handle this as on a self-compassionate way and see our weaknesses as a common human feature. Christine Neff also says that be kind to yourself when suffering and be tolerant and patient toward your weaknesses and imperfections. Then finally, mindfulness is very popular, but I think it's not because of it's popular, but it is popular because it somehow gives a good answer to people's need. That by accepting our feelings and thoughts and bodily sensation in the situation helps to keep a balance. So maybe this picture helps us to see what is mindfulness. That many times we are present in our body, but our mind is very far away with our worries. And mindfulness helps us to find the balance and to come back to the present. So the mindful attitude means an awareness of reality, acceptance of reality, letting go of expectations in a non-judgmental and non-reactive way, and most important, the most important, keeping distance from our thoughts, kind of metacognitive awareness, because a catastrophizing thought not necessarily true, and if we are aware of that, it helps to come back to our balance.
We'll have to close in 2 minutes.
Yes, yes. It was so great to see that even the Lancet, this very prestigious journal, in the middle of the pandemic, published an article for emergency healthcare workers that, of course, they don't have 20 minutes a day to be mindful, but it's possible to take a break, to breathe, maybe in the emergency room, and it's called Mindful Moments. I like it very much. We translated it with my young colleagues, and we spread it over at the university clinics and hospitals. So people put it on the nursing room window, just to see that. Give yourself some time and stop for a moment. As you breathe in, focus your attention on your breathing. As you exhale, relax every muscle of your body. Feel how your feet touch the ground. Feel the safe ground under your feet. Let yourself go into this experience and relax here for a while. And we received feedback that the doctors has used it. It's again some advice. I don't have time to go through maybe just the second one. It was a very important advice for doctors that be proud of yourself. What a great help you are to your fellow human beings. And you are at the IFOTES when you help people at the telephone. You can be also proud of yourself. What a great help you are to your fellow human beings. And remind yourself of these great experiences of healing. And just a couple of last slides. Exercise, back to nature, go to the forest. And if you have time, you can see the many studies which supports the positive effects on mental health of the forest bathing or going back to nature. And going to the forest and going back to the nature, also a kind of mindful experience, and they can create a sense of being present and being grounded and feeling safe. So this is my last slide, and maybe this is the take-home message that the less is more, and if we are just grounded in the present experience, then it is great, and it can give a kind of fullness of the experience and of the life. Thank you very much for your attention.